Hi, everyone. My name is Taylor Simmons. I am a master's student in the Environmental Health Sciences program at the University of Arizona. And today I'm going to be talking about a project conducted with the university and Muhimbili University of Health and Allied Sciences based in Dar es Salaam, Tanzania. This study looked at how social determinants of health shape climate change resilience and health outcomes in Tanzania. I know there are some loaded terms that some of us might not be familiar with, so I'm going to spend the next couple of slides going over them. So, what is resilience? Essentially, it's a person or a community's ability to recover from adversity. And there are three well-accepted stages of resilience. One, adsorption. So that's the community's ability to, are they prepared for whatever adversity that they might be facing? Adaptation, self-explanatory. How is the community adapting to the changes? And restoration. What does it take for the community to get back to the pre-stage scenario? So a good global example is the COVID-19 pandemic. We were not prepared for the pandemic, and we attempted to adapt in several different ways, from different types of masking, clustering, meeting outdoors, working from home, etc. And I'm not sure if we've gone to pre-stage scenario yet. Last I checked, there were 770 million cases attributed to COVID and 70 million deaths worldwide. So for the Global South paradigm of climate change resilience, we're looking at governance and leadership and how they're the foundation of resilience. Are they employing responsible agencies to make sure that locals on the ground know what's going on, what changes are occurring, what they can do? And self-efficacy bet is, what is the community doing to mitigate whatever issues that are arising? And in this case, it's climate change. So, social determinants of health. Lots of factors that go into it, including food access, economic opportunity, education access, water, sanitation, and hygiene. But essentially, it's where you live, are born, and work. And we know more about someone through their zip code than through their gene code at this point. So climate change. It's well accepted in the literature that carbon dioxide emissions contribute to climate change outcomes. So here's a graph on the right that shows the carbon dioxide emissions by continent. So you can see that Africa has not contributed or benefited from the industry's emissions of carbon dioxide, and yet they still suffer the consequences of climate change. And there's an unfair debt of burden on Africans to deal with these issues. So, how does climate change influence health outcomes? Well, let's look at waterborne diseases, for instance. There are a lot of different ways, but we'll focus on that. So this study looked at cholera and dysentery outbreaks. So cholera has been an endemic in Tanzania since 1977. And if you're diagnosed with cholera, or if you show symptoms, your life could end within hours of showing symptoms. Cholera thrives in salty, warm environments. And the diagram on the right kind of shows the outline and process of how climate change has increased cholera outbreaks. So human activities, carbon dioxide emissions, increases greenhouse gases. That leads to rising surface temperature, rising acidity of our ocean, salinity changes, and intrusion of salt water into coastal areas. Flooding as well, more extreme natural disasters, droughts, and water scarcity, coupled with poor sanitation and lack of infrastructure. You're going to see more cholera outbreaks. They had a recent outbreak in 2015 through 2019 that caused 300,000 cases and 500 deaths. So that kind of spurred this project, taking action in collaboration with the University of Arizona and MUHAS. I'm taking epidemiology right now, and I'm learning about the father of epidemiology, John Snow, and how he used GIS to mapping to solve the cholera outbreak in London hundreds of years ago. But we're still seeing these problems in the global south. Dysentery as well is a waterborne illness that occurs frequently in these areas. Without adequate hydration, they could be fatal, and over 60% of these fatalities are children under 5 years old. So let's delve into our study. So we looked at all of these aspects: social determinants of health, climate change resilience, and health outcomes in Dar es Salaam, Tanzania. It's one of the most populated areas in Tanzania along the Indian Ocean. There is room for, an exorbitant nightlife. We had a lot of fun being there. We had weekends off. Know that throughout the week we were working, but it also offers room for water tourism. So I went scuba diving while I was there. And also, if you're into Freddie Mercury, Zanzibar is just an hour's boat ride away. So although it has 2.5 million residents, even more tourists visit each year. So we attempted to better understand climate change resilience, health outcomes through many methods. So household surveys, these were started in June of 2023, and they've been ongoing with our MUHAS team. But the project itself started a couple years ago. Research in global South countries takes a lot of planning and permissions, and our PI on the project, Dr. Bikyeombe, went to Tanzania before us and met with every individual hospital and district in person to make sure that it was okay that we could collect this data and that they were on board and willing to help us out. So with household surveys, right now we have data that represent about 360 households, about 2,000 individuals, 260 of which are under 5 years old, 110 are over 65, and 43 identify as disabled. We collected hospital data from 8 health centers. The hospital data are decentralized. Although they're inputted every day, they aren't extracted and analyzed for, patterns and health outcomes. These health centers just don't have the capacity to do so. In addition, we got Tanzania Meteorological Authority data, so climate change data, looking at temperature, precipitation, humidity, flooding events, etc. And we also want to know public water system manager experience on the ground and the hindrances to providing safe, clean drinking water to their customers. So I really like this kind of graph that shows temperature changes from 1901 to 2021. On the top bar is the observed mean temperature in Tanzania, and the bottom is in Dar es Salaam. So you can see how temperature has influenced this coastal community and how this could, with extreme natural disasters like flooding and drought, cause negative health outcomes. So we're still in the process of analyzing all of this data. And this is just the first aim of the study. We're also hoping to conduct water quality assessments to determine exposure risks at the tap, and also developing a community-driven action plan and AI techniques to monitor for extreme disasters. But for aim 1, as for climate change, we are seeing increased temperatures, more frequent flooding, and changes in weather patterns, both with the Tanzania Meteorological Authority data and also with household perceptions. As for health outcomes, we're seeing increased incidence of diarrhea diseases, again, with the health center data and what we have compiled for the households. So in terms of climate change resilience, income, education, and housing significantly correlated with knowledge about climate change parameters, the causes and outcomes of parameters, and also willingness to make changes. They're all willing, for the most part, to do changes, but over a quarter of them had not taken any action in the last 5 years. This action includes building retention walls for floods, taking advantage of rainwater harvesting, treating their water, etc. And although we considered novel climate change inventions like water or carbon dioxide absorption from the water, from the atmosphere, more renewable energy sources, the reality is that we cannot move our communities forward, our global South communities forward, without addressing basic social determinants of health, basic human rights like access to food, water, and shelter, economic opportunity, etc., that will thereby increase their climate change resilience and ability to adapt to these changes. Thank you very much for listening. Oh, here we go. Start this video. Thank you very much for listening to my presentation and to all of the external collaborators at the University of Arizona. Global Institute helped put this project together, and AIR helped fund the project, at least from the University of Arizona side, the College of Public Health as well, of which I'm a part of, and Muhimbili especially, and their work in putting this together and helping this project happen. So if you have any questions, feel free to reach out to me at tbwilliams@arizona.edu. I look forward to hearing from you guys.